السلام عليكم ورحمة الله وبركاته. أهلا بكم جميعا. معكم الطالبة البراك، واليوم بإذن الله راح أشرح محاضرة Pulmonary Infections وإن شاء الله تستفيدون. هذه الأشياء اللي راح أتكلم عنها اليوم عن Risk Factors, Definition of Pneumonia، وراح نتكلم عن Community Acquired Bacterial Acute Pneumonia أو Atypical Pneumonia. Then finally we're gonna discuss lung abscesses in brief. So أول شيء إيش هي predisposing factors to infections especially in the lung. First of all, a defect in immunity as an innate humoral or cellular immunity may predispose an individual to infection, or cigarette smoking, as cigarette smoking compromises mucocellular clearance and it inhibits the alveolar macrophage activity, and these are the protective mechanisms of the lungs. If it was compromised, it won't be able to protect the lungs. And alcohol intake, as alcohol impairs the cough reflex and it interferes with neutrophils mobilization and chemotaxis. So first of all, what is pneumonia? إيش هو definition حق pneumonia? Pneumonia is a respiratory infection characterized by inflammation of the alveolar space and or the interstitial tissue of the lungs. يعني هو بشكل عام any infection in the lungs, and it is most commonly a bacterial infection, but it can be viral, parasitic or fungal. طيب, how we can classify pneumonia? Classification of pneumonia is based on clinical features as either typical or atypical pneumonia, وكل نوع has its own spectrum of commonly associated pathogens. يكون له certain pathogens commonly associated with it. أول شيء راح نبدأ بالcommunity acquired bacterial acute pneumonia. بس قبل تعرفون إيش يعني community acquired, يعني it is acquired outside of the hospital. It is not a nosocomial infection. So what are the common organisms implicated in community acquired acute pneumonia? في أكثر من organisms موجود عندكم بالمحاضرة, بس حطيت the most common ones, which are the Streptococcus pneumonia or Haemophilus influenza and Staphylococcus aureus. طيب, whom are the high risk groups of having this type of pneumonia? They are patients with underlying chronic diseases as COPD or heart failure or diabetes, as these individuals will have a compromised immunity, so they're going to be more disposed to this type of pneumonia. And congenital or acquired immunoglobulin defects and deficient splenic function. So بشكل عام أي شيء ممكن يأثر على الاميونيتي ممكن يخلي هذول individuals more predisposed to community acquired bacterial acute pneumonia. طيب, what are the clinical features of acute bacterial pneumonia؟ من اسمها هي acute, فبيكون عندنا acute onset of fever and chills and productive mucopurulent cough and pleuritic chest pain. تعرفون pleuritic chest pain اللي هو يكون في pain بالبلورا when inhaling or exhaling. Okay, what are the complications of this type of pneumonia? غالبا most pneumonias may cause abscess formation, and we're going to discuss abscesses in more details at the end of the lecture. And empyema, which is a suppurative pleuritis, and lung fibrosis, and the bacteria may disseminate to the blood, moving to other organs as the meninges, joints or the heart, causing bacterial dissemination, leading to meningitis, arthritis or infective endocarditis. Moving on to the morphology of this type of pneumonia, it can present as one of the two anatomical patterns, يا أما bronchopneumonia أو lobar pneumonia. طيب, إيش الفرق بينهم؟ البرونكونيمونيا there will be a patchy distribution of inflammation involving more than one lobe. زي ما تشوفوا من الصورة هي عبارة عن patchy distribution متوزعة, مو بأنه بشكل متجانس, وغالبا involving more than one lobe. زي ما تشوفوا من الصورة هنا it involves middle lower lobes. طيب, what is lobar pneumonia? Lobar pneumonia, it is a homogeneous inflammation of part or all of a lobe. من هذه الصورة هي تأثر على كل اللوب غالبا أو جزء منه, بس أهم شيء راح يكون homogeneous, يعني راح يكون متجانس. طيب, regarding lobar pneumonia, the lower lobes or the right middle lobes are most frequently involved. هذه ممكن تسألون عنها, إنه what are the most common sites of lobar pneumonia. طيب, نتكلم in more details عن البرونكونيمونيا. زي ما قلنا قبل, there will be a patches of consolidation. It will be multilobar, غالبا تأثر على أكثر من لوب, and it is mostly bilateral and basal, and the patches may be grey, red to yellow in color, surrounded by zone of hyperemia and edema بسبب الانفلامation. ممكن نلقى focal suppurative exudate filling the bronchi and bronchioles and the adjacent alveolar spaces. هنا نشوف bronchopneumonia in gross and microscopic. On the left you can see the lower lobe of lung is involved والlight tan peribronchial areas هذه عبارة عن acute inflammatory cells and الفايبرين. طيب microscopic photo اللي هي on the right هنا نقدر نشوف عبارة عن focal distribution of the inflammatory process surrounding the bronchioles بس حتى we can still see the normal areas لأنها هي إيش patchy distribution ما تأثر على كل المكان. والحين راح نتكلم عن المورفولوجي of lobar pneumonia. وزي ما قلنا قبل اللوبر pneumonia راح تكون عبارة عن homogeneous inflammation affecting a lobe or part of a lobe وراح تمر بأربع مراحل اللي هم congestion stage, red hepatization stage, grey hepatization stage, then finally the resolution stage. ومرة مهم تعرفون هذه stages لأن غالبا راح تنسألون عنها. مثلا أول stage اللي هو congestion stage من اسمه راح يكون فيه احتقان للدم فبيكون عندنا heavy red vascular congestion and the alveolar spaces contain proteinous fluid وscattered neutrophils and bacteria. alveolar space راح يكون فيه proteinous fluid وscattered neutrophils ما راح تكون accumulated لا راح تكون متوزعة and the bacteria. Then moving on to the red hepatization stage من اسمها hepatization stage راح تكون liver-like consistency. هذه gross photo of lung تشبه مرة الليفر بسبب هذه stage and the alveoli are packed with neutrophils, RBCs and fibrin. هذه الالفيولاي تشوفون انها مليانة neutrophils و RBCs و fibrin and the pleura shows fibrinous exudate. And then the third stage which is the grey hepatization stage there will be dry lungs grey and firm من اسمها راح تكون grey وإيش السبب إنها صارت grey و dry بسبب lysis of RBCs and there will be persistent fibrin exudate in the alveoli راح يكمل يكون موجود. Finally this is the last stage which is the resolution stage بتحاول تشيل كل اللي صار قبل فبيصير عندنا enzymatic digestion و resorption of inflammatory fluids and cellular debris and there will be restoration of the normal airways and the air sacs زي ما تشوفون الألفيولاي بدأت تفضى and macrophages remove the suppurative exudate اللي كان مكمل بالlast two stages وبيكون عندنا organization وكذا نصير خلصنا stages of the lobar pneumonia. الحين راح نتكلم عن other type of pneumonia which is the community acquired atypical pneumonia. So what is community acquired atypical pneumonia? It is a pneumonia with less distinct symptoms and unremarkable findings on auscultation and percussion. يعني إذا جينا نسوي الإكزامينيشن ونسوي auscultation أو percussion ما راح يكون عندنا significant findings and it manifests as interstitial pneumonia. إيش يعني interstitial pneumonia؟ يعني pneumonia affecting the tissue between the alveoli بعكس النمونيا اللي تكلمنا عنها قلنا it will manifest as bronchopneumonia أو lobar pneumonia بس هنا in case of atypical pneumonia it will usually manifest as interstitial pneumonia. It is mild to severe course and it affects the children and young adults most commonly. So what are the causative agents of this type of pneumonia? One of the most common causative agents is TB and certain viruses as influenza virus or para-influenza virus or cytomegalovirus or chlamydia infection. طيب, what is the morphology of this type of pneumonia? It will be patchy or affect the whole lobe. It might be unilateral or bilateral, affecting the both lungs. There will be red-blue congested lung, and there will be absence of inflammatory cells and the alveolar space. هذه المعلومة مرة مهمة إن زي ما تشوفون هنا إن هذا الalveolar space بيكون فيه absence of inflammatory cells بعكس النمونيا اللي تكلمنا عنها. And the alveolar septa زي ما تشوفون it will be wide and edematous and show mononuclear inflammatory cells. هنا راح تكون inflammatory cells بالسبتة that is between the alveoli. And what type of inflammatory cells? There will be lymphocytes and macrophages. بعكس acute bacterial pneumonia كانت mainly filled with neutrophils. So what is the clinical features of the atypical community acquired pneumonia? There will be flu-like symptoms or laryngitis to tracheobronchitis, which are inflammation in the larynx, trachea and bronchi. There will be modest sputum, no consolidation and leukocytosis. There might be high white blood cells and no bacterial isolates. Moving on to the last part of the lecture, which is the lung abscesses. طيب إيش هذه اللung abscesses؟ هي عبارة عن localized area of separative pus necrosis within the pulmonary parenchyma, resulting in formation of one or more cavities. زي ما تشوفون من الصورة عندنا cavities، يا أنها تكون واحدة أو multiple زي هذه الصورة. طيب إيش الأشياء اللي ممكن تسبب هذه lung abscesses؟ ممكن بسبب inhalation or aspiration of infected material أو gastric content فتسبب لي بهذا النكروسيس اللي سبب لي cavities، أو بسبب زي ما ذكرنا قبل بسبب النمونيا، أو bronchial obstruction or septic emboli or homogeneous spread. So what are the site of abscesses? The site of abscess depends on the cause. يعني مثلا in case of aspiration abscess إذا أحد مثلا كان يأكل وسوى aspiration الفود particle غالبا بتروح للرايت لانج، ونعرف ليش، لأن البيسك اناتومي يقول ان الرايت برونكس بتكون more vertical، فغالبا الفود particle بتروح to the right lung. فعشان كذا in case of aspiration abscess it will be mainly solitary يعني وحدة and affect the right lung. طب وين بالتحديد بالرايت lung؟ in the posterior segment of upper lobe or apical segment of the lower lobe. طيب in case of abscess following bronchostasis or pneumonia as in our lecture بتكون mainly multiple and occur in the base. طيب in case of abscess due to septic emboli it will usually be multiple and occur in any region، بأي مكان ممكن تصير. وهنا نقدر نشوف lung abscesses. هنا in a microscopic photo نشوف عندنا focal abscess containing neutrophilic exudate والdark blue colors، هذه عبارة عن bacterial colonies. البكتيريا تدخل بهذه الابسسز وتتكاثر فيها. On the right side we have gross photo of several abscesses زي ما تشوفون أكثر من وحدة with irregular or rough shaped surface walls are seen within areas of tan consolidation. والحين راح نتكلم عن آخر شيء بالمحاضرة اللي هي complications of lung abscesses. إيش الأشياء اللي ممكن تؤدي لها؟ ممكن تؤدي إلى scarring أو rupture into the pleural cavity which leads to bronchopleural fistula. زي ما نعرف إن fistula هي عبارة عن opening أو passage between two things اللي مفروض ما يكون موجود. فهذه الابسس ممكن تكمل تسوي cavity لما تطلع على pleural cavity and leading to empyema or pneumothorax. And lung abscesses may lead to embolization of septic material to the brain and leads to meningitis or brain abscesses. وكذا وصلنا لنهاية المحاضرة. حاولت أذكر أهم النقاط اللي فيها وإن شاء الله أنكم استفدتوا من الشرح. وإذا عندكم أي أسئلة أو أي استفسارات don't hesitate to contact me and thank you for listening.